Welcome to the first episode of the Heal Project podcast, brought to you by the Heal Project. We are a student-led nonprofit organization dedicated to sharing accurate and understandable information about health and wellness. You can find us across social media at the Heal Project 48. In the episode description, you can view various links, including a link to our blog, a form to apply to work with our organization, and our contact details. I want to make it clear that we are a group of students sharing information we learn through reliable sources. However, we are not doctors, dentists, therapists, or licensed medical professionals. This podcast is purely educational and meant to raise awareness. This is not personalized medical advice. If anything we discuss resonates with you, please reach out to a healthcare provider or a trusted adult. Today, we are going to discuss dental health. Dental health is something that is more complex and detailed than it seems. There are things happening in your mouth every single day that most people have no idea about. Let's start with the basics, the structure of your teeth. A tooth has several layers. The outermost layer is called enamel. Enamel is the hardest substance in the human body, even harder than bone. It is made mostly of a mineral called hydroxyapatite, which is a crystalline calcium phosphate. It is incredibly strong, but it has one major weakness: it cannot repair itself. Unlike bone, which can regenerate, enamel does not contain living cells, which means when it's gone, it's gone. Underneath the enamel is a layer called dentin. Dentin is softer than enamel and is made up of tiny tubes that connect to the nerve of the tooth. This is why when enamel wears away and the dentin becomes exposed, teeth become sensitive. Inside the tooth is the pulp. This is the living part of the tooth. It contains nerves and blood vessels. When a cavity gets deep enough to reach the pulp, that is when serious pain kicks in. Usually, when the cavity gets this deep, a root canal is necessary. Lastly, there is the root of the tooth, which sits below the gum line and anchors the tooth into the jawbone. The root is covered by material called cementum that connects to the bone through a structure called the periodontal ligament. This ligament acts like a shock absorber and allows the tooth to flex very slightly under pressure. Adults have 32 teeth in total, including the 4 wisdom teeth. Each type of tooth has a specific job. The incisors at the front cut food, and the canines tear food. The premolars and molars at the back of your mouth crush and grind food. Every tooth in your mouth is designed for a purpose, and when one is lost, the others have to work harder to compensate. Understanding the layers of the tooth helps us to understand why dental problems happen. The enamel is the first line of defense. If it erodes or gets damaged, everything beneath it is more vulnerable. Properly protecting your enamel is, in many ways, the most important part of dental health. Now, let's talk about plaque, because plaque is where most dental problems begin. Your mouth is home to hundreds of different species of bacteria. Most of them are harmless or even beneficial, but a handful of the bacteria are directly responsible for tooth decay. Here is how the process works. Every time you eat or drink something that contains sugar or carbohydrates, the bacteria in your mouth consume those sugars. As a byproduct of that process, they produce acid. That acid then sits on the surface of your teeth and begins dissolving the minerals in your enamel. This process is called demineralization. However, your saliva makes sure to fight back. Saliva contains calcium and phosphate, which helps remineralize the enamel after acid attacks. Saliva also helps to neutralize acid over time. When acid attacks are frequent or when the acids are very strong, the remineralization process cannot keep up. Over time, the enamel weakens, a small hole forms, and a cavity develops. In the early stages, a cavity affects only the enamel. At this point, it is possible to reverse some of the damage with good remineralization and fluoride. But once the cavity progresses into the dentin, it needs to be physically removed and filled by a dentist. Plaque is the sticky film that forms on your teeth when bacteria accumulates. If plaque is not removed through brushing and flossing, it hardens within 24 to 72 hours and becomes something called tartar. Tartar is mineralized plaque and cannot be removed with a toothbrush. It requires professional cleaning. Tartar buildup is one of the main reasons regular dental visits matter. One thing that's important to remember is that sugary foods are not the only thing that can cause excess acid. Citrus fruits, vinegar, and fizzy drinks can also erode enamel. Now, let's talk about a very underestimated dental problem: gum disease. Gum disease affects the tissues that support your teeth, the gums, the ligaments, and the bone. Studies estimate that roughly half of adults over the age of 30 have some form of gum disease, and many of them have no idea. There are two main stages of gum disease. The first is gingivitis. This is inflammation of the gums caused by plaque buildup along and beneath the gum line. The symptoms are typically mild. Some of the symptoms include slightly red or swollen gums and bleeding when you brush or floss. The good news about gingivitis is that it is completely reversible with improved oral hygiene. The bad news is that most people do not address it at this stage. When gingivitis is left untreated, it progresses to periodontitis, the more serious form of gum disease. At this stage, the infection moves below the gum line. The bacteria start destroying the connective tissue and bone that hold your teeth in place. Pockets form between the teeth and gums, creating even more space for bacteria to group. Teeth can become loose, and in severe cases, they can fall out. Periodontitis cannot be reversed. It can be managed and halted, but the damage that has already been done cannot be changed. This is why catching gum disease early is so important. Another scary fact about gum disease is that it doesn't just stay in your mouth. Research over the last few decades has made a very strong case that periodontal disease is linked to serious health conditions. The bacteria from infected gum tissue can enter the bloodstream and travel to other parts of the body. Periodontal disease has been linked to heart disease, strokes, diabetes, and respiratory disease. Remember, your mouth is not separate from the rest of the body. What happens in your gums affects your whole system. Now, let's talk about food and drink, because what you put in your mouth has a direct impact on your teeth. The frequency of sugar consumption matters more than the quantity. Eating a large piece of cake in one sitting is actually less damaging than snacking on small amounts of sugar throughout the day. Every time you eat something sugary, you trigger an acid attack that lasts for roughly 20 to 30 minutes. If you are snacking constantly, your teeth are under continuous acid attacks with no recovery time. This also applies to fruit. Fruit is healthy and full of nutrients, but it does contain sugar and in many cases is also acidic. Eating fruit as part of a meal is much better for your teeth than spreading it out throughout the day. Fizzy drinks, including diet versions, are acidic and erode enamel directly. The sugar in regular soda adds a bacterial acid attack on top of the direct erosion. Diet drinks avoid sugar, but the erosion still happens due to the fizz. Even fruit juice, which many people assume is healthy, can cause damage because it's often very high in both sugar and acid. If you do drink acidic or sugary drinks, there are a few things you can do to help minimize damage. You can use a straw so the liquid bypasses your teeth as much as possible. After drinking something sugary or acidic, do not brush your teeth immediately. When enamel has been exposed to acid, it is temporarily softened. Brushing it at this point can scrape away the weakened mineral layer. Try to wait at least 30 minutes before brushing and drink water in the meantime to help neutralize the acid. Now that we know what's bad for your teeth, we need to talk about what's good for your teeth. Calcium is essential. Your teeth and jawbone are largely made of it. Dairy products are the most well-known source, but calcium is also found in leafy greens, almonds, and sardines. Phosphorus works alongside calcium in building and maintaining tooth enamel. It is found in food such as meat, fish, and eggs. Vitamin D is also critical because without it, your body cannot absorb calcium properly. Good sources of vitamin D include fatty fish, egg yolks, and sunlight. Vitamin C is another important vitamin because it supports the production of collagen, which is a key component of gum tissue. Making sure you get enough vitamin C through fruits and vegetables can help support your gum health. Another thing that is helpful in regards to overall dental health is drinking plenty of water because it helps rinse away food particles and bacteria, dilutes acids, and supports saliva production. Saliva is your mouth's natural defense system, and staying hydrated keeps it working properly. Now, let's talk about something very important to teeth health: fluoride. Fluoride is a naturally occurring mineral found in soil, water, plants, and many foods. In dentistry, it is used because it helps to make the enamel more resistant to acid. When fluoride is present in the mouth from toothpaste or professional treatments, it gets incorporated into the enamel structure during remineralization. The result is a compound called fluorapatite, which is significantly more resistant to acid than the original mineral structure. Fluoride essentially makes it so your enamel is harder to dissolve. The evidence supporting fluoride's effectiveness is among the strongest in all of dental research. Studies conducted over decades and across many populations consistently show it reduces cavities. This is why it is added to public water supplies in many countries, and why it is an active ingredient in virtually all toothpastes. Although fluoride is typically harmless, it can cause a condition called fluorosis. This is caused by too much fluoride during childhood when teeth are developing. Mild fluorosis causes faint white streaks on the teeth. Severe fluorosis, which requires much higher levels of exposure than you would get from typical fluoride use, causes pitting and staining. Using a fluoride toothpaste is one of the most impactful things you can do for your dental health. So, what does a good daily dental routine look like? You should aim to brush your teeth twice a day, once in the morning and once before bed. Brushing before bed is especially important. During sleep, saliva production drops significantly, which means your mouth's natural defenses are reduced overnight. Brushing before bed removes plaque and dramatically reduces potential acid damage while you sleep. When you brush your teeth, you should try to brush for at least 2 minutes with a soft bristled toothbrush. Medium and hard bristled toothbrushes do not clean better. Sometimes they can cause more damage. Aggressive brushing with a hard brush can cause gum recession and enamel abrasion over time. If you have the option, electric toothbrushes are worthwhile. Multiple studies show that electric toothbrushes can remove more plaque more effectively than a normal toothbrush. If you do use an electric toothbrush, make sure to replace your brush head every 3 to 4 months. Your toothbrush cannot reach the spaces between your teeth, which is why flossing is so important. You should aim to floss once a day, ideally before you go to sleep. If you are unable to use traditional floss, try floss picks or a water flosser. The important thing is that you are cleaning between your teeth every day. Using mouthwash can help support your teeth, but it does not supplement brushing or flossing. If you do use mouthwash, don't use it right after brushing, as it can rinse away the concentrated fluoride your toothpaste leaves behind. No matter how well you take care of your teeth, it is not a substitute for professional care. Try to visit your dentist every 6 months. People who are at higher risk may need more frequent visits. A typical dental checkup includes an examination of your teeth for cavities, cracks, and wear, an assessment of your gums, x-rays periodically to detect what is not visible to the naked eye, and a screen for early signs of oral cancer. The hygienist appointment removes tartar buildup that brushing cannot address. Remember that early treatment is almost always far less expensive than late treatment. A small cavity is a simple filling. That same cavity left for 2 years may require a root canal and crown, which would be significantly more expensive. Regular visits are a long-term financial investment. The more important thing for dental health is consistency. Good oral health is not built through occasional intensive effort. It is built through simple actions done every day. So, that's dental health. I hope this podcast taught you something new. If you have any questions, you can comment below. We will be posting about different health-related topics every Sunday, so if that interests you, you can subscribe to this channel. Thank you for listening.